Hi.
Hello, everybody. My name is Ken Abrams. At Deloitte, I serve as the firm's Chief Medical Officer.
Good afternoon, everybody, and thanks for taking the time to spend with us again today. I get the privilege of hosting today's discussion, where we'll talk a little bit about virtual health and specifically focus on some of the concepts around the ability to deliver hospital-level care at home. I am a physician. I'm an anesthesia critical care doc by training, and then I joined Deloitte 9 years ago now. I'm Deloitte's Chief Medical Officer for the U.S., and have the privilege of working with a group of about 65 physicians, clinicians, and scientists in the firm as we serve clients in lots of different ways across life science and healthcare. Talk a little bit about virtual health, and we'll get into the concept of hospital level care at home and what that looks like. Healthcare as we know it has really changed dramatically in the past months, right? Since we've all been living these virtual lives that we're living. Doctors' offices closed down, hospitals kind of shuttered a lot of programs and access to things because they've been overwhelmed, and a lot has exploded into the virtual environment. So I'm curious to know what you all have been seeing and experiencing and hearing and maybe even partaking in as it relates to, this new mode of delivering care, which isn't really quite new, but, we've moved the needle probably 5 to 10 years into the future.
Since quarantine, I have had to have some telehealth calls, not just for my kids, but for myself. And I feel like I have enjoyed them. It's actually been good. You get the phone ready and, it seems to be working semi-seamlessly, but I just feel like the level of care has been still very good. And I feel like I'm having more email communications with my doctors, which, I'm 38. I kind of enjoy that too, because I feel like I also live this life where I'm checking my email. And I can check everything. I can see blood work results from years past. And so that just kind of makes me feel good that everything is in one central place and I have access to it at all times. And all my doctors have access to it. Because me having to see a hematologist and then a neurologist and then a cardiologist all in preparation for a surgery I'm going to have, it makes me feel good that everyone has access to the same information at the same time.
During the pandemic, everybody has turned into a telemedicine doctor. Your doctor, urgent care, the telemedicine doctors that existed already. But what they're lacking, and they're trying to foster relationships, but video conference, when you have a sore throat, makes like 0 sense. And I know as a mother of 3 grown children in their 30s, when they were young, I really wanted that hands-on touch. The doctor knew their bodies, knew where a mole was, knew what looked different. And I think that it's going to happen. I think we've whet everybody's appetite. 2 things happen. One is we started to reimburse people for telehealth visits, and that's huge. And 2, people are using it more because they had to. Now what has to happen is we need hardware attachments in your home so that the doctor can still be on a video call with you, but can actually see in your throat, look in your ears, listen to your heart, hear your cough, etc. And I think that's what's missing.
I've seen telemedicine work really, really well for triage. Is this something where we need to risk going to an urgent care or going to an emergency room? And 9 out of 10 times, those telemedicine visits have taken care of something so that they don't have to go and be in more risk being in a place. The last place most of us want to be is an urgent care or a hospital. one of the biggest problems that people are reporting about is that you have to buy into an additional platform. So you don't just have to have the gadget, but either the provider or you as a consumer have to have an additional HIPAA compliant platform. So there's some struggles on both ends. We are so much further than we were 6 months ago, but we still have a long way to go.
I do want to thank everybody for participating today. This has been a really engaging and stimulating conversation. I have learned a ton from all of you. So thank you for sharing your thoughts and participating. We really do appreciate it.
Thank you, everyone.
Thank you, everybody. Have a wonderful week.
Stay well, everybody.
Stay well.
Thanks so much for moderating. Take care.